Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, November 24th, 2020. And it's a big week, so let's get right into it with cases increasing here in the US, though in worldwide they have more or less plateaued. There's still 4.2 million cases in the last week, though that was the same as the week before. There are a lot of countries, especially Europe, where there is seeing some trending downwards, but the United States is making up for that with 1.2 million new cases in the last week alone, which is 200,000 more than the previous week. Here in Massachusetts, we saw 18,000 cases, which was roughly the same as it was the week before. So let's keep our fingers crossed on that. In terms of deaths, however, those are rising across the board with 70,000 deaths in the last week worldwide, about 5,000 more than the week before. Here in the United States, we saw a spike up to 11,000 deaths, which is about 3,000 more than the week before. And here in Massachusetts, we saw 191 people die from COVID-19, which is 14 more than the week before. So looking at where the trends and counts are, everything is still continuing to trend upwards with a record high for hospitalizations, 85,000. Our record high for new cases in a single day was just last week, Friday, just under 200,000 cases reported in that day. And just looking at that another way here, this is just a full chart there. You can see where we've hit. Now, it's lower the last 2 days there, but Mondays and Sundays are usually the lowest days. So we'll probably expect to see that tick up this week. We may even pass a 200,000 new case day this week. But we might not, but not for good reasons, as we'll talk about in a moment. Just looking quickly at where this is happening. This is the regional breakdown of new cases. As you can see, every region is experiencing more cases than it was at its previous peak in the summer or spring. Of course, with the Northeast, since we really didn't have much of a testing apparatus at that time, the cases we had back then were likely many times more, but just looking at the numbers we're seeing right now in the Midwest, South, and West, we're just seeing skyrocketing amounts, and the South has even passed its high point of the summer there, which was another big surge. This, of course, gets very troubling when this translates into hospitalizations. So real quick, this is where we stood last week in terms of the number of people hospitalized per million people in any given state. So just take a quick look at that there. And then we're going to bounce over to where things stand this week. So everything's trending upwards about, I think North Dakota might be slightly down. But you'll note they had to basically redraw the scale to account for how things have gone up. Before, the darkest shaded hexes there were for 400 plus. Now they're for 500 plus, with South Dakota just really at its limit there, with over 658 people per million people hospitalized. Now, the peak we've ever seen was 968 in New York in April. So we're not at that point, but obviously places like South Dakota are not as well provisioned with hospitals as New York City is. So currently there are only 4 states that have fewer than 100 people per million people in the hospital right now. That's, of course, Vermont, New Hampshire, Maine, and Hawaii. So it's just really hitting right now, and we can only expect this to increase as the case numbers reaching new highs, and there's usually about a 2-week lag between cases and hospitalizations there. And looking at how this trends in terms of deaths, you can see the red line here is cases, new cases by day, and the gray line is new deaths. And as we look here, you can see how, generally speaking, it's been a couple weeks between the spike in cases and deaths, and you can see where we've started to hit that new spike in daily deaths. There are some people estimating we may see as many as 2,000 deaths a day in a couple of weeks from now. As you can see how it's spiked up significantly in just the last couple of days here on the right. Another way to look at this is that Monday is usually the lowest day for reporting in the week, Monday or Sunday, and this is the number of deaths reported on Monday for the whole scope of the pandemic. So you can see kind of a vague, it's the same sort of general outline of how the deaths looked here, with the major spike in April, coming down into early summer, spiking again, but not quite so much at the end of July, beginning of August, coming down. And now here's where we are right now on November 23rd, where we are basically at the beginning of May again there and trending upwards. So that just shows you what we have to look forward to in the coming weeks, when it will be rather unfortunate. And one other thing to note about the coming weeks too is that Thanksgiving is likely to be a massive super spreading event, multiples of those hyper spreading events, if you will, just with thousands of people still planning to travel, to spend indoor meals with families, and how that's just a perfect recipe for massive spread. So we should expect to see case counts spike in the coming weeks. However, because of the holiday weekend, we may see reporting drop. Around Labor Day, which was another holiday that slowed down reporting, there was a significant drop in reporting there, which sort of threw off the trends there for a little bit. We seemed to be lower than we really were for a little bit. And then when we were really more or less plateaued, deaths were trending down at that point, but then spiked back up as a result of the sort of late reportings. So we may not really get good numbers for the next couple of weeks as well. So things are likely to get worse, and we won't know how worse they are until early mid-December. And then things will suddenly seem like they have spiked even more. So if you see case counts that appear to be going lower early next week, don't get too excited about that. It's likely a reporting issue rather than actual there. We may also get in some places the point where we're just not really able to keep up testing with new cases, especially in some of those places in the Midwest where they're really hitting their highs there, and we just made that, they may just be the limits of the testing capability. We may just see it seem to plateau for a while as we just are getting tests back that are just all positive. If we only have 20,000 tests in an area, that's the limit of positive cases we can have there, for example. All right, so with that, let's move on to developments. A lot of interesting things on the medical front this week. So first up, the CDC has released a statement saying that most COVID transmission is asymptomatic. That is, from people who are not experiencing any obvious COVID symptoms, coughing, fever, etc. So I say about 60% of transmission comes from people with no symptoms, with about 25% having no symptoms whatsoever for the entire course of their illness, and 35% having no symptoms yet, people who will later go on to exhibit symptoms but haven't started showing them yet. As we've seen in the past, COVID is transmissible, often most transmissible in the days before symptoms really develop. So only about 40% of people, only 4% of transmission comes from people who are actively symptomatic, which is an important factor. It also has been seen by some public health specialists as a sort of tacit acknowledgement of aerosol transmission, which is, that kind of, small droplet that hangs in the air for several hours and is very likely to cause super spreaders events indoors, because when you are asymptomatic, you are putting out a lot more aerosols than you are droplets. So in vaccine news, we've got early results on another vaccine candidate from AstraZeneca at the University of Oxford. And their vaccine, remember we had Pfizer and Moderna reporting in the mid 90% efficacies, whereas AstraZeneca reports 70%. This is, perhaps slightly disappointing when compared to those other ones, but it's a little bit interesting because it was initially shown to only be 62% effective. However, a small group of participants, about 10% or so, were given a smaller first dose followed by a full second dose. Like with the Pfizer and Moderna project, this is a two-step vaccine. You get an initial one, you get a booster shot about a month later. And in that group that had a smaller first dose, the vaccine was found to be 90% effective. They're not really sure exactly why this is. There's some thought that the smaller first dose kind of stimulates the immune system better so that it doesn't completely fight off the second dose and better replicates a natural infection. But the really wild thing about that is that was done by accident. There was a small subset where they mismeasured the first vaccine group and completely by accident gave these people like a half dose basically, and that turned out to work better. But again, it is a small sample size, so we don't really know for sure. There is a bit more we're going to do on this, and going forward with their trials, they are going to be moving to trying that half dose, full dose thing. I don't say it's exactly a half, but at a smaller dose. And even though if that doesn't turn out to be effective, and the main dose is in that 60s to 70s range, that could still be useful in a lot of areas because one key thing with this vaccine is that it is much more shelf stable than the others we've looked at, which have to be kept very cold. The AstraZeneca vaccine can be kept in a normal refrigerator for 6 months. Doesn't require anything fancy. So that's hugely important for just the supply chain, especially in parts of the world where it might be harder to get the kind of deep freezers that the other vaccines would need for long-term storage. Again, it is also a completely different vaccine delivery system than the other two we've seen in the last 2 weeks. So that is good to always have more options out there. Now, AstraZeneca could have a couple million doses by the end of the year. We're not likely to see them here in the United States because it is a European-based company. But that is, there are other parts of the world that need to get vaccine too, not just us here in America. Speaking of the rest of the World Health Organization has rejected remdesivir as a COVID treatment. It has been authorized by the FDA here for use in the United States for hospitalized patients after a study showed that it could reduce hospital stays by about 4 or 5 days. However, a World Health Organization study recently determined that there really was no benefit to remdesivir. It did not have any significant changes on mortality, on need for oxygen supplementation. So they have rejected it. So it's going to be kind of interesting how it's something we'll be using here in the United States, but the World Health Organization is not endorsing it for the rest of the world. One other thing, though, the FDA has approved is Regeneron. This is the antibody cocktail that the president famously got when he was tested positive for COVID a few weeks ago. So this is a treatment for people who are in the early stages of COVID infection. It's not for people who are hospitalized or on oxygen, unlike remdesivir. So we should see this jumping up production soon. However, it is likely to be very expensive. This is probably not a treatment that a lot of people are likely to be able to get, unfortunately, which is another actual benefit of the AstraZeneca vaccine. It's likely to cost about $3 or $4 per shot, which is very nice and cheap. And speaking of the vaccines again, Pfizer has put in its emergency use authorization application for its vaccine. So if everything goes well on that, we may see Americans getting their first vaccines in mid-December. There won't be a lot of them at that point. It'll probably be given to healthcare workers and or people who are most vulnerable, perhaps nursing home residents first. So most of us won't be seeing that for some time, and there is a pretty stringent process it has to go through for the next couple of weeks for review. I know a lot of states are also planning to do some independent review of the data as well to confirm that this is going to be a effective and safe treatment. But so far things are looking good for that to happen. And just wrapping up with a look at vaccines overall, we should be seeing in a couple of weeks those columns on the right starting to increase. The only major change here is just a shift over. So there's one more project in phase 3 as a couple more vaccine trials keep coming online at this point. So we will, again, next year, at some point, have a lot of vaccines to choose from. You can find our sources in the usual spots. I use the New York Times for the numbers at the beginning, COVID tracking project for all those wonderful charts, and mass.gov for Massachusetts-based statistics. For more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands. We'll be here if you need us. Stay safe.